Hey everybody, this is Dr. David Martin at Precision Chiropractic here in Durham, North Carolina. And I just wanted to make mention to something that happened yesterday. I had a meeting with a guy from the community. We met here in my office. He came out and he saw this poster, which my wife made, by the way, which says, which one needs maintenance? There's two different kinds of cars on there. One's a little bit of an older beater, kind of a fun little car to drive around. One's more of like a sports car. And he stood there for a second, just kind of looked at it and kind of laughed and said, ha, he's like, oh, obviously they both do, which, as you can see at the bottom of the poster, is exactly what it says. So I just wanted to talk really briefly about maintenance care. A lot of different types of people and professions get a little bit concerned about when chiropractors talk about what maintenance care means and why people need maintenance care. And there's been a number of studies, two very interesting studies by German orthopedists that show that when parts of the spine or parts of the hips, any of the weight-bearing parts of the skeleton get misaligned, then within 2 weeks, there can already be some cartilage damage that can start to damage the joint, which is the precursor to arthritis. It's what leads to arthritis down the road. So taking care of and keeping things lined up and working the right way is really important for all the parts of the body, but especially the spine because of how it affects the nerves and the nervous system. So different people recommend different kinds of frequencies for maintenance care. There's no formula that's right for everybody. I get adjusted every week or every 2 weeks depending on my schedule, but it really depends on kind of your lifestyle and some underlying factors and what we see on the x-ray. So for some people, they have a really easy life, low stress, they've had little trauma. Maybe they only need to be adjusted once a month or once every 3 months. Maybe little kids only need to be adjusted every 3 months. But for adults, most active adults, maybe once every 2 weeks would be more appropriate for them. So more like for myself, that's how often I get adjusted. So some people that are really crazy athletes, that are really pushing themselves, professional athletes, high intensity athletes like CrossFit athletes, they need to be adjusted even more frequently, maybe once a week. So it just kind of depends on your lifestyle, kind of some of the underlying factors, what your x-rays look like. So that's something we can talk about, or that we should talk about if you ever are a patient or if you are a current patient here in the office. So one thing I just want to make a distinction about is that some chiropractic offices that do maintenance care, some of the discount chiropractic clinics that you might see that are more of the franchise type clinics, do really maintenance care, but they don't have x-rays, they're not working off of anything specific, and they do a lot of the same kinds of treatments on people over and over again. So it's not really a distinct, specific type of care that maybe you need. So most people should be analyzed carefully. I use a technique that's called the Gonstead technique. It's the gold standard in chiropractic care. It's really specific and precise. We look at the whole spine on every visit and only adjust the areas that need to be adjusted in a particular visit. So when you're talking about maintenance, it's really important to be careful and adjust and take care of only the areas that need to be taken care of. So anyway, a lot more to say on that, but I hope that was helpful for you. Thanks, Dr. David Martin.